Hi, this is Dr. Badawi with Westlake Dental Care. In this video, I will be talking about why dentures are only a temporary solution. Stay tuned, I'll be right back. Alright, so we're going to go down the list from immediate drawbacks to the long-term drawbacks of regular dentures. Here we go. Reason number one, which is a common reason that is across the board with all regular denture patients, discomfort. Dentures have a plastic-like feel to them. They don't feel natural like your normal regular teeth. This is an especially common complaint for patients who get their top row of teeth replaced by a denture. I have an example with me here. As you can see, the upper denture has a larger surface area as opposed to the lower regular denture. This additional space in the upper helps keep it in place, but the texture of the material can be annoying to many people. So when a patient gets dentures for the first time, there are an adjusting period they have to go through. In addition to that, dentures don't just sit in place perfectly and function properly. As I always say, dentures without implants are for smiling, and for smiling only. You have to get something known as a denture paste, which is something that helps keep the prosthesis in place throughout the day. The paste is applied right here in this groove where the dentures would sit on top of the gums. As you can imagine, the combination of plastic-like feel to dentures and the denture paste can be difficult to live with. It takes some real getting used to, and many patients never make that full transition to total comfort. Okay, so on to the next one. Reason number two is lack of functionality. This relates back to what we were just talking about, which is dentures not staying in place perfectly by themselves. The only thing holding the denture in place is the denture paste that you placed and the natural suction fit of the denture itself. That's why the denture in the top row of teeth needs that extra surface so that it can achieve the suction with the roof of your mouth. This can be sufficient throughout the day if you're just talking to people or you're sitting on your desk typing away. However, it becomes problematic when you want to eat. Obviously, teeth play a big role in helping us eat. And as you know, teeth are securely fastened to our jaws through roots. Regular dentures don't have those roots, so when you go to bite on an apple or a piece of chicken or steak, those roots are not there. It becomes difficult to effectively chew food. This is why most regular denture patients are forced to eat soft foods like soup, or if they try to eat meat, they'll have to cut it into small, tiny pieces. Imagine having to deal with that for years on end. It's not a pleasant experience. And this takes us to our final reason. This one is by far the biggest drawback of regular dentures. Reason number three, bone recession. Many people are totally unaware of this, but our bones were designed to have two opposing forces pressed down on them. What do I mean by that? Well, I have an example here of a past patient. When you're missing one or multiple teeth, the jawbone in that area will start to recede. As you can see from the patient's x-ray, this patient's bone has receded 80% over 12 years. Here's why this happened. In order to maintain healthy bone structures, we have to have those two opposing forces pressed down upon them. That pressure, in combination with our tooth roots, prevent our bone from receding and help give us our natural facial structure. That's why many denture patients will have their face start to sink in over time. As their bone continues to thin out, they start to develop wrinkles on their face. And their dentures actually need to be replaced a few years later because their jaw structures has changed so much over that period of time. If you're thinking about getting regular dentures, please take into account all these factors. Dentures are a great temporary option if you just want to look better aesthetically, but over time, they have some real drawbacks. I hope this video helped you. If you liked hearing this information, please share this with your friends and family. I hope they will get something out of it as well. My name is Dr. Badawi with Westlake Dental Care. Have a great day.